Hi, I'm Art Caplan. I'm at the Division of Medical Ethics at the NYU Grossman School of Medicine in New York City. Well, I recently saw a ban that has me very worried, concerned, and strongly in opposition to this ban. Nassau County, which is about 60 miles east of New York City out on Long Island, instituted a ban on people wearing masks. Basically, the standard kind of medical mask would be captured, although I think their aim in doing this was to try and discourage people at political protests from being able to wear masks and hide their identity. They're basically trying to discourage that, particularly triggered, by the way, by I think protests about the war and invasion of Israel and the war that resulted in Gaza and the demonstrations that have gone on around the country with many people masked. Look, there may be issues about what is acceptable or not to wear when you go to a demonstration. I don't claim to know about the civil rights of that. But I do know that including medical masking under this ban, which Nassau County has done, and by the way, has now also elicited a ban in North Carolina, including the right in North Carolina of any property owner, if you enter their house or business, to ask you to take the mask off. I think in a time at which COVID is flourishing, really on the rebound, expanding fast, causing 600 deaths still a week, the flu season is going to be upon us soon enough. There are also concerns about the possibility of avian flu uh, jumping from cattle and dairy into the human population. It is absolutely the wrong time to single out those who are trying to mask for health reasons and say they can't do it. Basically, there are two strong reasons. One, there are people out there who wear a medical mask or mask for a medical reason because they have an underlying disease. They have had a transplant. They feel they're immunocompromised for some reason, and they worry that if they don't wear a mask, they're going to get an infection from something like COVID or flu, which could really be super dangerous for them. The other reason people mask is to protect their family members. They may have someone who's immunocompromised in the family, or kindly and altruistically to protect the rest of us, to stop viruses from circulating. These bans are not taking into account public health. They're being brought forward in the midst of political heat about demonstrations and political issues. I think they should be opposed. I do not think they should be enacted. I think the medical rights of people with disabilities, immunity disorders, and those who want to mask to prevent getting sick at a time at which infectious diseases are still circulating and killing people ought to take priority. Public health, in this case, should drive our policies about masks. I'm Art Caplan at the Division of Medical Ethics at NYU Grossman School of Medicine. Thanks for watching.